I can fully understand why someone might feel worried about seeing their GP. It can be scary, and a lot of the time people feel that they may be judged negatively or they may feel embarrassed about it. My name's Dr. Gemma Newman. I'm a GP and I work in West London. All GPs are trained in quite a similar way, and we're all here to help basically. There's lots of different things that we can do to help you if you self-harm, and you shouldn't feel afraid to come along. It's our job and we want to help. I'll ask people about when they self-harm, if they self-harm very often, what kind of self-harm they do. Obviously not everyone self-harms in the same way. I'd also ask a bit about your triggers and also ask about mental health problems or low mood, anxiety, because those things often come hand in hand with self-harming. And sometimes I might also ask to examine you if you've got any specific injuries or new cuts that you might need attention. But it won't be scary, and I do it a lot and a lot of GPs do as well, so please don't be afraid to come along. I think the first person you talk to about self-harming should be someone that you trust. That's the most important thing. Someone that you think is going to react in a relatively positive way. GPs are good because they have an objective point of view and they're there to help you, so they won't necessarily be emotionally involved with the self-harming at all. But they're not necessarily the first person you might want to talk to. Whatever you say to your GP will always be in the strictest confidence, and it will always stay in the consultation room. There are a couple of exceptions to that rule. The first exception might be if the GP is genuinely concerned that you're at risk of killing yourself, and the second exception would be that if the GP thought that you were actually at risk of harming another person. Sometimes your GP will follow you up on their own, especially if they've had expertise and experience in mental health. Sometimes though, and most usually, they'll refer you on to someone else. And that could be a counsellor, it could be a cognitive behavioural therapist or CBT therapist, and sometimes also it could be a psychiatrist or a psychiatric nurse. And it often depends on the services available and also on the individual. If you feel that the advice you've got from your own GP isn't quite what you'd hoped for, an option is to see another doctor at the practice. Quite often, although we're all trained in a similar way, there are often differences in personality and approach, and it may just be enough to see someone else at the surgery, someone else that you feel that you can talk to a bit better. In addition to that, if you want to see someone else as well, you could access psychotherapy or counselling independently. You don't have to give any kind of reason to your GP if you want to change them. It would be simple enough to just go along to another practice in your catchment area and sign up with them. I can think of one girl in particular who I treated who had been self-harming from her very early teens, and having seen me a few times and also going to counselling, she developed other ways to channel her negative emotions, and she found it really useful to write a journal of her feelings, and she also took up kickboxing, which really helped her to have another channel for her negative feelings. And so that case, and along with many others, have made me feel very hopeful over the years as well.